How do you know if you're actually having a prostate problem? You're not a doctor. You don't have context. On today's episode, we're talking about when you actually need to go to the urologist when you have a prostate problem. Let's go. Welcome to the Dr. Gio podcast. I am your host, Dr. Gio, where it is my full intention to help you with your urological function and how to live better with age. Today, we're going to talk about the three things you need to know to learn if you indeed have a prostate problem. If you are a man, you have a prostate, and at some point, there's going to be a problem with it. It's just a matter of time. I always joke that with friends that are of age, and I tell them, look, you haven't seen a urologist? Look, it's only a matter of time before you're going to have to come and meet my index finger. It's only a matter of time, right? You can run, but you can't hide. But before you go to the urologist, because we know how we are, right? Like, we don't go to doctors. We have to it has to be an arm falling off our body to go to a doctor. But you don't know what you don't know, right? You don't know, like, hey, hold on, maybe right now I actually do need to go to the urologist. And you're running away because you don't want the test, you don't want the finger test, and you're running away because you don't want to be in a vulnerable situation. I actually understand that because I am you, so I understand why you wouldn't want to go. But when should you go? When should you not be stubborn and listen to perhaps to your girlfriend or your wife and say, look, you need to go, right? When is that? So here are the three things that you need to know. First of all, what are the three prostate problems? The three big prostate problems. There are BPH, or an enlarged prostate, prostatitis, or an inflammation of the prostate, and prostate cancer, right? Those are the big three. So in one scenario or another, you're trying to figure out, do I have BPH? Do I have prostatitis? Or do I have prostate cancer? And there might be some overlap there, but stay with me. Let's go over the three things you need to know if there is a prostate problem. Problem number one, or issue number one, right, is urination. Is there urinary frequency? And so what's urinary frequency? Because no one really knows. I don't know. I think you don't have context. Urinary frequency roughly is in the daytime. If you have to go, let's say, every 2 hours or less. If you have to go pee every 2 hours or less, then you probably have a prostate problem. If you have to pee, more every 2 hours and a half or 3 hours, you may not. Do you have to wake up at night to urinate, right? Called nocturia, right? Do you have to wake up more, once a night? Not a big deal. You have a lot in your head, right? You went to bed and you're thinking business and you're thinking all your problems. You wake up at 2:00 in the morning and then you have to go. That's likely a result of you not sleeping well or not getting into a deep sleep. So if you are sort of awake at 2:00 in the morning, then you're saying, let me just go to the bathroom, right? Let me just go pee. So what comes first? You're in a deep sleep and the feeling of having to urinate wakes you up to go to the bathroom, or you are not in a deep sleep and then you're saying, okay, let me just go and urinate, right? What comes first? Urgency. This is the scenario where you can't, you're sitting in the movie theater and you're always with the aisle seat. You take the aisle seat in an airplane, you take the aisle seat in a movie theater because you know that, when the time comes, you need to run and make it there on time. The urgency. That may be a sign of a prostate problem. Now, Dr. G, I heard you before and you said, well, it's not always a prostate problem. Well, that's correct. It's not always a prostate problem, but sometimes it is, right? Sometimes there's obstruction of the urinary system where you're having, you see that the stream is a little weaker. Then that causes other problems where it causes frequency and urgency and nighttime urination. So yes, it's not always prostate related, but it can be. It can be a prostate problem. And you want to know that. Also, I can't tell you the amount of times I've seen men that come in with urinary problems. And then we take a PSA, right? This is a 45, 46-year-old man. In most cases, is like, no, you're 46. Well, why are you going to get a PSA in a 46? You're too young. And that's not the right approach, but that's a conversation for a different day. 46 years old, comes in, urinary problems. Let's get a PSA. PSA can be high, 10, 15, 20. And then that can lead to a diagnosis of prostate cancer where we can catch it early and then do something about it, whether it's holistic approaches and natural approaches or medical or combined integrative. So you want to get that checked out. Any urinary problem, it might be a prostate problem. So you want to go get it checked out. Prostate problem number 2, blood in the urine. Dr. Gio, you said it. Blood in the urine is not always a problem. And yeah, sure, it's not always a problem, but it can be. It could be prostatitis, which is inflammation of the prostate, right? It could be prostate cancer. It could be bladder cancer. It could be, most of the times, is nothing serious, but it could be a prostate problem. So you want to get that checked out. The thing is, if you have to find a problem early, then it's always better than finding it later. You know, my general rule in life, and this is like what I talk to my kids about, is like, deal with the problems early. They just become a bigger problem later on, harder to deal with. Like, just nip it in the butt. So go get it checked out, right? You can run, but you can't hide. You can't hide. All right. That's number 2, right? Blood in the urine, also called hematuria, in case you look things up. And that's another word that's used. That's the technical medical word, hematuria. The third thing you want to acknowledge if there's a prostate problem is this sort of heaviness in what's called the perineal area. That's the area between the scrotum and the anus. It's like this heavy feel. It's like, people would say, you know, I feel like I'm sitting on a golf ball. I always feel heavy there. That may be a sign of prostatitis. And sometimes you feel some discomfort or pain in that area, lower part of the abdominal area, lower back, or on the testicles, along with urinary problems. So typically it's both. And sometimes a fever would accompany it. Not always, because there is such thing as non-bacterial prostatitis, right? This is a situation where there's no bacteria, at least that we can find, and no signs of infection, no fever, but still you feel that heaviness, that urinary, that discomfort, that pain that comes along with it. Prostatitis. Prostatitis, you might have seen some of the episodes that we've done before on prostatitis. I talk about it, pretty frequently. It's also, I write about it at drgio.com, what to do about it, so sign up to the newsletter. If you are not a member of the Dr. Gio community, shame on you. Shame on you. I'm doing all the work so that you don't have to. You're spending so much time on the internet and reading some crap out there where you can be reading stuff from the expert, the expert here, and that's drgio.com. So sign up. Yeah, I think you'll enjoy it, and you're going to get insider type emails that no one else gets. Okay. That aside, prostatitis can be it is often an inflammatory situation, an inflammation of the prostate. It's caused by whatever. It could be a UTI. It could be from an STD, a sexual transmitted disease. It could just be that a bacteria or a microorganism lodged into the prostate, and it could be non-bacterial, or it has a history of bacterial, then it's not and becomes chronic. It's sort of all over the place. Prostatitis is a little bit of what's called a diagnosis of exclusion. So you don't have A, you don't have B, you don't have C based on symptoms. It has to be prostatitis. So it's a little bit weird. And the part of the problem with prostatitis is that it's treated often with antibiotics. And so antibiotics are a problem when it's overused and abused. And so you want to be careful with that. And there's tons of natural approaches to treat prostatitis. So if you're feeling that feeling of, heaviness between the scrotum area and the anus, the perineal area, that might be prostatitis. Sometimes a good treatment for that, just as an FYI, is a prostate massage. So many of you are running away because you're like, I don't want no finger up my butt. But sometimes one of the treatments for things like prostatitis is finger up your butt. And it's like a 30-second massage of the prostate, and people oftentimes feel better from that. So this type of feeling, heaviness, prostatitis, go get it checked out. I'm going to end here with this. You don't want to be foolish. I always say, look, I don't want to go to doctors. I mean, I don't want to go to doctors. I have other things to do. I'm busy. I don't want to be in a vulnerable situation. I get it. But the thing is, you have to know when. You have to know when, there's this feeling in your left side of your chest that's radiating up your jaw, and that may be a heart attack. and then you need to go. There's no, right? You need to know when. And I think that that's one of the things we do here on Dr. Gio podcast is this is when you really need to, forget about the natural stuff, go get it checked out. And then you could do the natural stuff, the botanicals, the nutraceutical supplements, the lifestyle, the diet, which is very effective and it works well. You could do that too. Let me know what you think of this podcast episode. Leave your comments below. I am reading them, and I promise that I'll be commenting back and replying when possible. I hope this podcast episode helps you determine when you have a prostate problem that needs to be checked out. This is Dr. Gio signing off. I'll talk to you next time.